The invitation arrived at my parents' house with a brief text from Mom. Family table. Black tie. Don't embarrass us. The Metropolitan Children's Hospital Charity Ball was the city's premier philanthropic event, held annually at the Hartwell Estate. My family had attended for 15 years. Dad sat on 3 nonprofit boards, Mom chaired the Opera Guild, and my sister Claire had married into the Ashford family, whose pharmaceutical fortune made them charity circuit royalty. I was the family outlier. At 31, I'd spent 8 years in international development, coordinating medical supply chains in East Africa. My family called it my charity work, with the tone people use for embarrassing hobbies. What they didn't know was that 7 years ago, I'd used my inheritance from my grandmother to establish the Morrison Global Health Foundation. We'd started with small clinics in Kenya and Tanzania, then expanded to education initiatives, clean water projects, maternal health programs across 18 countries. Last year, $847 million in grants distributed. Our endowment had grown to $3.2 billion. I'd kept the foundation completely separate from my family name. My board knew me as Dr. Sarah Morrison, my grandmother's maiden name. The foundation operated independently with no Reeves family involvement. And 5 years ago, when the Hartwell estate came on the market, my foundation purchased it. We used it for fundraising events and rented it to other nonprofits at reduced rates. The hospital paid us $50,000 annually, a fraction of commercial venue costs. Tonight's venue? I owned it. I arrived in a midnight blue gown. The mansion glowed with uplighting, the grand ballrooms sparkling with chandeliers and elaborate florals. I found my family's table near the back, not premium placement despite Dad's board memberships. Claire and her husband Preston sat with Preston's parents, the Ashfords. Mom wore her society smile. Dad networked with the hospital's board chairman. Sarah. Mom air-kissed my cheeks. You look lovely. Preston's parents are here. Please don't monopolize conversation with your African stories. They're major hospital donors. Claire hugged me warmly. Still in Tanzania? Kenya currently. Expanding our maternal health network. Preston's mother, Victoria Ashford, turned at expanding. She was 70, imperious, dripping in diamonds. Sarah works in international development, Mom explained quickly. Charity work overseas. How noble, Victoria said with the tone that meant the opposite. Preston mentioned you live quite rustically. I spend time in rural areas where the work is needed. Victoria dismissed me, turning back to her husband. Dad returned with Douglas Whitmore, the hospital board chairman. Douglas, my family, my wife Patricia, daughters Claire and Sarah. Douglas shook hands. When he reached me, Sarah. What do you do? International development. Medical infrastructure primarily. That's nice. His attention shifted immediately to Preston. Your family's foundation grant last year was instrumental. I wandered the silent auction displays while my family clustered with the Ashfords. No one introduced me. I overheard Mom. Both our daughters are here. Claire married Preston Ashford, you know the family. And Sarah does charity work abroad. Very passionate about helping people. Making my work sound like a phase. Dad was worse, speaking with Douglas. We keep hoping Sarah will come home and apply herself to something more substantial. Something more substantial. Years building healthcare infrastructure dismissed as less valuable than attending charity balls. Hold up. Dinner was served, elaborate chicken at $500 per plate. Victoria Ashford held court, describing the Ashford Foundation's strategic giving philosophy. We believe in supporting institutions demonstrating excellence, she said. Preston chairs our selection committee. He's very discerning about which causes merit our support. Preston nodded. We conducted extensive due diligence before committing to the Children's Hospital. Infrastructure quality, outcome metrics, leadership competence. Philanthropy should be strategic, not emotional. He said it looking at me like my work was driven by bleeding heart sentiment rather than rigorous analysis. The speeches began. Douglas Whitmore took the stage, thanking donors and describing the hospital's impact. Then donor recognition. We have several tiers based on cumulative giving. Bronze level, $50,000 to $100,000. Polite applause. Silver level, $100,000 to $500,000. More applause. Gold level. $500,000 to $1 million. Louder applause. And now, our platinum level donors. $1 million to $5 million. Preston straightened. Victoria touched her husband's arm. The Ashford Family Foundation. $2.1 million over 5 years. Our table erupted. Preston and his parents stood, waving. Cameras flashed. Victoria glowed. My parents clapped enthusiastically, basking in reflected glory. Please join us on stage, Douglas said. The Ashfords walked forward. Preston gave a brief speech about pediatric healthcare and strategic philanthropy. The audience applauded. Our table beamed. Douglas returned to the microphone. We have one more recognition tier. Our diamond level, reserved for donors whose contributions exceed $5 million. The room buzzed. Diamond level recognition was rare. This year we have one diamond donor. Their foundation has supported not just our hospital but healthcare initiatives globally. They've asked to remain anonymous, but tonight we're honored to recognize them publicly. My phone buzzed, a text from my foundation's executive director. Heads up. Hospital insisted on public recognition tonight. Sorry. I hadn't planned this. We'd quietly funded the hospital's low-income patient care program for 3 years, $12 million with minimal recognition. But the hospital board had decided tonight was the unveiling. The Morrison Global Health Foundation has contributed $12.4 million over 3 years, Douglas continued. These funds have provided care for over 8,000 uninsured children. We're hoping their founder is in attendance. He looked around. Dr. Sarah Morrison? Is Dr. Morrison here? Revelation. The room went silent. Hundreds of heads turned, searching. At our table my family sat frozen. Mom's face went white. Dad's mouth hung open. Victoria looked confused. Claire whispered, Sarah? I stood slowly. Every eye found me at the back table where they'd seated the less important family member. Dr. Morrison. Douglas beamed. Please join us. The walk felt endless. I passed platinum donors, gold donors, people applauded for 6-figure contributions. Douglas shook my hand. Dr. Morrison, we're so grateful. $12.4 million is our largest private donation in the hospital's history. $12.4 million. 6 times the Ashford contribution. From the woman they'd seated at the back. Your foundation's focus on uninsured care has been transformative, Douglas continued. Could you tell us about the Morrison Global Health Foundation? I took the microphone, looking at the sea of faces. My family sat processing. Thank you, Douglas. The Morrison Global Health Foundation was established 7 years ago to address healthcare infrastructure gaps in underserved communities worldwide. We operate medical clinics in 18 countries, primarily East Africa. We've expanded into education, clean water, and maternal health. Screens behind me lit up with images. Our clinics in Kenya, schools in Tanzania, water projects in Uganda. Last year we distributed $847 million in grants. Our endowment is $3.2 billion. We're on track to exceed $1 billion in annual giving within 2 years. Gasps rippled through the audience. $1 billion in annual giving. We focus on sustainable, measurable impact. We don't do philanthropy for recognition or tax benefits. We do it because healthcare is a human right. I paused, looking at my family's table. Some people think working in rural Africa is less serious than attending charity balls. But real philanthropy isn't about applause or donor tears. It's about the mother in Tanzania who can now access prenatal care. The child in Uganda who survived because our clinic had antibiotics. The community in Kenya with clean water for the first time. Complete silence. One more thing. The venue we're in tonight, the Hartwell Estate, is owned by the Morrison Foundation. We purchased it 5 years ago to provide affordable event space for nonprofits. The Metropolitan Children's Hospital has been our tenant for 5 years. You could have heard a pin drop. Preston's face went purple. Victoria looked like she'd swallowed something bitter. My parents sat in stunned silence. Their daughter, the one they'd hidden at the back whose work they'd dismissed, owned the venue. Had donated 6 times what the Ashfords contributed. Ran a foundation that dwarfed everything in this room. Douglas recovered first. Dr. Morrison, on behalf of the hospital and every family you've helped, thank you. The applause started slowly, then built to a standing ovation. Real applause. People stood looking at me with new eyes, not as the charity worker who lived rustically, but as a major philanthropist whose foundation operated at a scale most couldn't imagine. Resolution. I returned through a gauntlet of people wanting to shake hands, exchange cards. The walk took 15 minutes. When I reached my table, shell-shocked silence. Mom's mask had cracked. Dad stared at his plate. Claire looked torn between pride and concern. Victoria spoke first, voice tight. You might have mentioned you ran a foundation. You never asked what I did. You asked where I lived, rustically, I believe. Preston's jaw worked. The Morrison Foundation. Major player in global health. I didn't connect. That Sarah and Dr. Morrison were the same person? No one did. Because none of you could imagine charity work in Africa might be serious philanthropy. Sarah. Dad found his voice. Why didn't you tell us? I did. 7 years ago. You said it was nice I was using grandmother's money for causes. You've spent every gathering describing my work as something I do while figuring things out. Mom's eyes filled. We didn't understand. You didn't try. You were too busy being embarrassed I didn't marry well or attend the right luncheons. Claire squeezed my hand. I'm proud of you. Thank you. I turned to my parents. I don't need your approval anymore. I've built something meaningful without the Reeves name, without your connections, without your validation. Douglas appeared. Dr. Morrison, several board members want to discuss expanding our partnership. Do you have a moment? Of course. I stood grateful for escape. The evening blurred. Conversations with hospital board members, nonprofit directors, donors who'd ignored me earlier. My family stayed isolated at their table, the social calculations recalibrating in real time. I left before closing speeches. My phone filled with messages, interview requests, partnership inquiries, gala invitations. One text from Claire. They're devastated. Please call tomorrow. I didn't respond. The next morning, society pages ran photos. The Ashford's platinum recognition was mentioned in paragraph 6. My diamond recognition led, mystery philanthropist revealed. Dr. Sarah Morrison's $3.2 billion foundation. By afternoon, my parents' friends called with questions. The Opera Guild wanted to know why Mom never mentioned my foundation. Dad's board membership suddenly felt less impressive. Preston's position as the Ashford selection chair was quietly eliminated after they realized they'd condescended to a philanthropist operating at 10 times their scale. 2 weeks later, Mom sent a letter. Long, handwritten, full of apologies. We didn't understand what you'd built. We'd love to be involved with the foundation. I filed it away unanswered. Dad tried calling. When I didn't answer, he emailed. Sarah, please. Let's talk about how the family can participate. They wanted in now that it was prestigious. 6 months later, the Morrison Foundation announced $1.2 billion in new grants. 15 new clinics, 3 university partnerships, expanded maternal health networks across sub-Saharan Africa. My family read about it in the newspaper like everyone else. The Hartwell estate continued hosting charity balls. Sometimes I attended when the cause mattered. But I never sat at the back tables again. The foundation's growth accelerated after that night. Major donors who'd never heard of us suddenly wanted meetings. Universities proposed research partnerships. International health organizations sought collaborations on vaccine distribution and disease prevention programs. Within 3 months, we received unsolicited donations totaling $420 million from philanthropists who respected our approach. Evidence-based, sustainable, focused on communities rather than publicity. Our board expanded to include former WHO officials, public health experts, and business leaders who understood both impact and scale. My parents tried different approaches to reconnect. Dad offered to introduce me to serious philanthropists who could help guide the foundation's strategy. He didn't seem to grasp that those philanthropists were already calling me, asking for my guidance on their own giving strategies. Mom invited me to speak at the Opera Guild's luncheon. It would be wonderful exposure for your foundation, she wrote. Exposure. As if the Morrison Foundation needed a 50-person luncheon to build credibility. I declined politely. The Ashford family fared worse. Their condescension at the charity ball had been captured on video, Victoria's dismissive, "How noble" comment. Preston's lecture about strategic versus emotional philanthropy. Someone leaked it to a philanthropy blog. The headline: Old money condescends to billionaire philanthropist at own event. The video went viral in nonprofit circles. Comments section brutal. Imagine explaining strategic giving to someone whose foundation gives more in a month than yours does in a decade. The irony of calling someone's work emotional while sitting in a venue they own. Preston resigned from the Ashford Foundation board within weeks. Victoria stopped attending charity events where she might encounter me. Their family's reputation in philanthropic circles never recovered, not from any action I took, but from their own captured words. Claire remained the only family member I spoke with regularly. She visited Kenya once, spent 2 weeks touring our clinics, met the communities we served. When she returned home, she was quiet for days. "I told Mom and Dad what you're actually doing," she finally said during a phone call. "The scale of it. The impact. They didn't believe me at first. They thought I was exaggerating." "And when you convinced them?" Dad cried. Mom couldn't speak. "They finally understood what they've been dismissing all these years. That must have been enlightening for them. Sarah, they're destroyed. They know they can't fix this. That they spent years belittling work that matters more than anything they've ever done." I felt nothing hearing that. No satisfaction, no vindication. Just emptiness where family connection should have been. "I'm sorry it turned out this way," Claire said. "I'm not. I built something real while they were busy being embarrassed of me. Their opinion doesn't change the clinics we've opened or the lives we've saved." A year after the charity ball, the Morrison Global Health Foundation crossed $1 billion in annual giving. We were ranked among the top 15 most effective health foundations globally. I gave a TED Talk that was viewed 12 million times. Forbes featured me on their cover, the philanthropist they didn't see coming. My family attended their charity events without me. The Reeves name still opened doors, but those doors led to smaller rooms now, with people who remembered the daughter they'd hidden at the back table. I built hospitals in Uganda, schools in Rwanda, water systems in Ethiopia. I worked with communities who valued competence over pedigree, who measured success in lives improved rather than social status achieved. And every time I wrote a grant, opened a clinic, or met with partners who respected our mission, I remembered that support staff badge, the one they'd metaphorically given me for years. Some people need your validation to feel worthy. I'd learned to validate myself.